So I felt like needed to tell my story, and so this is my attempt at that. I'm a newbie video maker, so yeah, my camera's not very good. This is just me sitting here talking to you like a friend. Um, so if you're expecting bells and whistles and fireworks, this is not the video. So basically, I recently and am currently involved in a health health issue. And one of the very first things I did was because I had tons of questions. And of course, you don't think of your questions till after you're home. I started looking for videos to try to understand what I was needing to expect. And there were a few, but not many. And I had specific questions that I wanted answered. And they only came after I experienced it. So I thought that I would make my own video because I feel like, there's going to be other women out there like me that are going to have questions, and that the more videos we can watch, the more experiences we get to listen to, the better prepared we can be. So I need to give you some basic background information so that way things will make sense. I think that I will probably eventually make videos about all of this other stuff, but right now, since this is the first one, I want to give it as background information. So let me start with, my name's Deb. Hello. So this is future Debbie, or editing Debbie, or however you want to say it. I realized as I was going through all of the video where I was talking about the mammogram and the ultrasound that I really went off on a couple of tangents and just really rattled on for a while and gave just a little bit too much information. And the raw video was like 45 minutes. And so I figured it would be better for me to cut that out and just step in real quick and tell you a couple of things real fast. Number one is my basic disclaimer that this is not medical advice. I'm not a doctor. I have no medical training. I'm just sharing my experience. If you are watching this because you have something going on in your body that you're concerned about, contact your doctor or your health professional and get help with somebody that has training. The second thing is, do not watch this video in place of doing what you need to do. And third thing is, don't expect that your journey will be the same as mine. This is just what happened to me. Okay, so that's out of the way. A warning here. I'm an earthy person. I talk about body parts with the correct word. I don't say boobs, I say breasts. And we're going to talk about the structure of the human breast because that's what we're talking about. That's what this whole thing is about. So I'm going to say words like nipple and areola, and I might talk about blood or discharges or all kinds of weird things. So if you're squeamish about that kind of thing, look away or maybe watch a different video. So the thing I think that I spent the most time on was rabbit trailing about things going on in my life. Basically, what I wanted to let y'all know is my past history with health issues. And that really is, about 13 years ago, I had endometrial cancer because I have, or actually technically at this point now had, polycystic ovarian syndrome. Long story short, the two often go hand in hand because of PCOS. Your hormones don't work right and you don't shed the lining of your uterus once a month like all the rest of the universe, and that can lead to endometrial cancer, which is what happened to me. I had a surgery. It was all taken care of. I have not had anything come back since then. But that is part of my story, and I reference back to it, I think, at least once or twice, if I haven't edited that out at this point. Second thing is that I have currently have a condition called multiple chemical sensitivity, and basically that is where my body cannot process toxins like everybody else's can. So that wonderful perfume that you spray or that Scentsy that you plugged in you think smells great hurts me. It injures me. It makes me sick. Only thing that I can do in order to stay healthy, and that's avoidance. That means I just don't go out very often. That turned into anxiety. Well, I was anxious to begin with. I've been anxious since I was a little girl, but that turned into agoraphobia, actually, would be more accurate. There was a point, the longest I went between times of leaving my home was 18 months at one point. That was the longest. in any case, that's what led to me not going to the doctor. That's what led to me not taking any medication. I had a lot of anxiety and a lot of fears about that. That led to super high blood sugar, super high blood pressure, super high cholesterol, and just a lot of stress in my life. And I'm 53. So let's play Guess What Happened to Debbie Next. If you guessed stroke, yep, you're right. 11 months ago, I had a stroke. Thank God it was a very, very mild stroke. It just affected the left side of my face and my left hand. I couldn't type properly. I kept dropping things. It didn't affect my walking or anything from the waist down. It took about 3 months for me to heal, but I think I'm pretty good. I'm alive. I'm breathing. That led to making a decision in my life. I knew I had high blood pressure. I didn't take the medication because I was afraid of two things. One, I was afraid it would drop my blood pressure and that I might pass out and get hurt. Second thing was I was just afraid of what those chemicals that make up the medication might do to my body through the MCS issue. And I was scared. So while I was sitting in that hospital room, literally, I was in the hospital for 4 days? 4 days. I sat there and literally had a talk with myself, and I decided that I would rather take the medicine and live with any possible side effects. If I had to be, reactive all the time, we call it the stupids because I have a lot of cognitive issues. I decided I would rather live with the stupids and see my grandson grow up and see my kids live their lives than to be too scared to take the medication and die sooner, because I knew that I was going to die sooner. And so I have since then tried to stick with that decision. I started seeing a GP, and she is the one that told me, hey, you're 50, I'm 53. She's like, you're over 50. You need to have a pap smear. You need to have a mammogram, and you need to have a colonoscopy. And so we negotiated on the colonoscopy. I'm doing a card test on that, but the pap smear and the mammogram is what started me down the path I'm currently on. So I just wanted to, I compressed that considerably, and it's taken me 7 minutes to talk about this here, and by the time I edit this, it probably won't be that long in the video, but I mean, in the video I had probably 20 minutes where I rambled on for a while. So hopefully that will help. Thank you. Back to your regularly scheduled program. Anyway, I got the appointment set up for the pap smear, and while I was there, they set up the appointment for the mammogram. So the nurse practitioner, I go to a local clinic because I only just this month, I've worked my first full month. I finally found a job that works for me. I'm a tutor, and I didn't have the money to pay for going to the doctor or doing any of these things. But Tina, I go to a local clinic. It's a income-based clinic called Access. And there is an amazing nurse practitioner, women's health nurse practitioner, I think is her official title. Her name is Tina. She is the one that I saw 13 years ago. She was the one that diagnosed me with endometrial cancer and sent me on to a gynecological oncologist. So I knew her. I love her dearly. She is an amazing woman. So Tina and I have this great history, so we're joking with each other back and forth. But one of the things I mentioned to her was that I have a nipple discharge, and I've had this for several years. Again, back with the whole MCS thing and being afraid of doctors and afraid of, anything. It's this really weird thing. And I also have health anxiety on top of it, which we used to call that hypochondria, but it's technically now they call it health anxiety. So I was able to convince myself that it's nothing to worry about. Now, looking back, I'm like, what the hell were you thinking? I just want to smack myself upside the head, and say, what were you thinking? So anyway, mentioned that to her. And so while what she does when she does the gynecological exam, she also does a breast exam, which is great because as I have lost weight, the girls have basically they've deflated. I mean, there's no other way around it. I Probably if I were a normal sized woman, I would probably only have a B cup. Um, Even at my heaviest, I was only a C cup. And that's part of that is because I had PCOS. PCOS women generally don't have big breasts. We have flat butts, big bellies, square shape, most of us, not all of us, and very thin and very small breasts. And that I'm that classical PCOS chick shape. So anyway, um, so she was doing the best breast exam. We were talking about it because I did not know what things felt very weird. And plus, I have all this skin. I have lots and lots of extra skin, and it had been stretched. So I had tons of stretch marks. So my skin is this deflated skin with stretch marks. And so I had a hard time feeling things. So it was good that she was there. And while she was doing the breast exam, the left nipple, the discharge came out because anytime you put pressure on my breast, that's when the discharge comes out. Now it's clear. It's not milky. It's clear, and it's kind of thick, um, viscous, I guess would be the best word. And it's a kind of a straw color, kind of light tan, light yellow. And the student doctor was like, "Oh, look!" He was like pointing. I was like, "Oh, there it is!" I'm like, "Yep, there it is." So it was great. I mean, he got to see that. I also have a sebaceous cyst between my breasts, so he got to see that as well. So he got like a 3-for-1 special with me. He got to see all kinds of different things, which I think is great because he needs to see these things if he's going to be a competent doctor. So anyway, when we were done with the exam, they had already been working on scheduling my mammogram. I live in Missouri, and my state has a program called Show Me Healthy Women. We're the Show Me state. And it's a program for low income women like me where we don't have to pay for our mammograms and our pap smears. And it's such a huge blessing. So they were calling through that program to get me set up with my local hospital. I was talking with Tina after I was all done, and she's like, "Okay, so here's what we're going to do. I'm going to send you down because the clinic that I go to, it has a lab in there." And she's like, "I'm going to send you over to the lab and we're going to run a blood test." Because the first thing we check for is to see if it's a pituitary tumor, because a pituitary tumor can cause a woman to lactate. And so we're going to check for that. So I went and I got the blood drawn, and I had they had set the mammogram date for like 2 weeks away from that. Actually for the 25th, which is on Monday. And so I was, my friend was driving me home. I don't drive. And my friend was driving me home. We stopped at her house for a minute, and while I was sitting there, I'm like, I don't want to do it. I mean, I know I need to get this done, but I don't want to do it right now. To be completely honest, I was a little afraid of the radiology from the X-ray, and so I called him and I moved the appointment to late November. The next day, I got my blood test results. They were testing for a hormone called prolactin, which is what the hormone causes you to lactate. And by the way, Tina had told me that if it was a pituitary tumor, then it's nothing to worry about, that they just give you some medication and that takes care of it. So I'm like, okay, I wasn't actually all that worried. But you hear the word tumor, pituitary is in the brain. I'm like, I don't need any help. I don't need any more problems in my brain. So I got the results. I'm the lab that we use in this town. I signed up with them, so I saw my results before the nurse actually did. So my prolactin level. They want women that are not pregnant or nursing to be 25 or below. I was 3.7. I mean, like, men have more prolactin in their system than I do. I'm like, I'm so not lactating. So there we go. There's that. So at first I was like, okay, yay, great, no big deal. And then it dawned on me like, oh, crap. If it's not that, what is it? So I did some Googling. I know Dr. Google is not a safe place to be, especially for someone like me that already deals with health anxiety. We should not go on Google. I try not to. I do, in a case like this, I will Google, but I stick with very reliable sources. So like the Mayo Clinic or Healthline, places like that. So looked that up and saw that there were several possibilities that it could be. And I'm like, no, I need to move my mammogram appointment back to where it needs to be. It needs to be like sooner than later. So I called them the next day, and I told her, I'm like, I need to move my appointment. I had moved it once, I need to move it back. And I said, I don't think I can spend 6 weeks worrying about this. And she's like, oh, hold on. She looked at she looked at my case, and she's like, oh, wait, with a nipple discharge, you don't need a regular mammogram. You need a diagnostic mammogram. I guess there's two kinds of mammograms. There's a screening mammogram and there's a diagnostic mammogram. And I'll explain those here in a moment. Anyway, so all that, I got prepared for the mammogram. I did some research on it. I wanted to see what to expect. So the diagnostic mammogram is basically a screening mammogram. Is you go in and they take the images, and then you go home, and then they holler at you later if you need something else done, or once they read the mammogram. But a diagnostic mammogram in my case was the mammogram first, and they take more shots than the screening mammogram. And then they also scheduled an ultrasound. So my mammogram was set for, today is Thursday. So a week ago, last Monday, so it's been 7, 8, 9, 10, 11, 10, 11 days ago, I went in, and my mammogram was for 1 o'clock and my ultrasound was for 2. And they said that I would probably have to have about a half an hour wait, but thankfully they have a waiting room for people that are waiting to get into the ultrasound room. So I didn't have to get dressed again and go back outside and then come back in. So went in, and I was the first appointment after lunch, which I like to get because everybody is in a better mood because they've just come back from lunch, and you can usually get in and out quicker. So went in, and the mammogram was, and my hospital also has a 3D mammogram machine, which is amazing. The machine looked a lot like this one. And so basically, if you're not familiar with what a mammogram is, there are lots of really good videos out there about what a mammogram is. But basically, the machine that I went to, she adjusted it for height, and then you lay your breast up on this table. It's a small table. It's about so big, and then she brings a clear clamp thingy down, and it was a little tight, but nothing horribly painful. The clamping itself was not painful. I was talking to a friend. Like I said, my breasts are very, very saggy. They're very flat. They're very small. So it's not going to hurt someone like me. My friend, another friend I was talking to about it, she wears a double D bra cup, and her breasts she's younger. She's about 10 years younger than me. So they're not all saggy like mine are. So it hurts her quite a bit because they have to compress quite a bit to be able to see, through that. So, when people say, oh, mammograms don't hurt, it's relative. It's relative. It depends on your breast. It depends on your tech. It depends on your situation. It wasn't like horrible. It was uncomfortable. But what was causing me pain was a twofold problem. I have so much extra skin that it was getting wrinkled and caught up underneath into the clamp, and it was hurting. But then she'd have to come and she'd have to readjust me to move me around to put me in where she needed me to be to get a good image. So that was hurting, but also another health issue I have is called a candida rash, and that is candida is, I believe it's a fungus. I need to do a lot more research on it, but basically it causes me to have bright red rashes, and they're weeping rashes. And I'm sorry, this is gross. They stink. The rash, the weepingness, it's liquidy. It stinks. It's horrible, and I hate it. It's under my breasts. It's underneath my belly, under the pannus, under my, the floppy part of the belly. I've talked to other people that can get it under your arms, in your crotch. Any place where it's damp and it's dark, you can get a candida rash. But also and I've been colonized by candida since I was 12, so 41 years. That's a long time. And so it breaks down the skin as well. So the skin under my breast is very, very, very thin. So as the tech was lifting my breast into the machine to take the image, it was literally tearing under my breast. So that is what was hurting. By the time I was done, I was torn under the left breast from here all the way to the other side, and the right breast here about halfway. And thankfully, it healed very quickly, a couple of days, and it was fine, but it hurt a lot. And so that's what hurt me about the mammogram. So the mammogram imaging, they do so like let me do this. If this is your breast, they bring the machine down, they keep the machine straight on, and they squish it from top to bottom. So that would be a vertical, so your breast is being seen vertically, right? Squished vertically. And then they do some where they turn the machine at an angle and they squish your breast kind of like that. So they did one of each of those on each breast. And then they also did a little bit around, since I have a lot of flesh on the side of my breast, they also did the side of my breast as well. So that's 6 images. And then they wanted to do one more of the left breast, since that's the one that has the discharge. So rather than the machine coming down like this, she turned the machine sideways, so it came up my breast like this. So here's my breast. It squished my breast like that. So that was the diagnostic part of the mammogram. Before they had started the mammogram, she sat me down. She asked me a bunch of questions, and it's your basic thing. You go in and you take off your top and your bra, and you put their cape on. In this case, it was more like a jacket, so you put it on so it's buttoning in the front. She said, "Yeah, it's one size fits all," and I'm like, "No, it's not one size fits all. I've lost enough weight now that I'm just getting into a size 3X, and it barely fit me, which I'm grateful because, just 20 pounds ago, it wouldn't have fit me at all. A year ago, I wouldn't have been able to put my arm in it, but so, and in fact, while we were doing the mammogram, I finally got tired of fighting in it because it kept falling off of me. And I finally just took it off, wadded it up, and tossed it in a chair. And I'm like, "I'm sorry, it's annoying me. Can we just do this like this?" And she's like, "Yeah, no problem." So I put my jacket, my cape back on, and she ended up getting me a robe to go over it, which didn't fit much better, but it did give me a little bit more coverage because I had to take my bag. I had put my clothes in one of the hospital bags, so I took my purse and my clothes and went to the other room. And one other thing, this is a tip I learned from another video. When you're getting ready to go in for a mammogram, don't wear any lotion or any powder or deodorant because they'll make you wipe it off. Now there was a basket with all kinds of wipies in it, and I could have wiped myself off, but I came prepared. I don't wear those things anyway, so it wasn't a big deal. But that's just something. If you wear deodorant, perfume, or lotion or powders, don't wear any of it because some of those things can cause the mammogram to not read properly because of reflective substances in those things. And as far as the perfumes go, just don't wear perfume. Have a heart for the people around you because those techs have to be around people all day long. And some people that are dealing with cancer, because, there's a higher chance that somebody with cancer is going to be in there having a mammogram because you have a lot more mammograms once you've had cancer. People that have had cancer and that have had chemo, they are often really, really sensitive to smell. So don't wear perfume either, please. Anyway, so then they took me down the hall to the waiting room for the ultrasound. She told me that the ultrasound order is going to be that they're going to ultrasound my nipple and around the areola, which is the dark circle that's around the nipple. And that probably they would do the right side as well. And she's like, I was to go down to the waiting room, and she was going to let the radiologist look at my mammogram, and then from there he would decide if I needed the ultrasound or not. So they came back in to tell me, yeah, we're going to do the ultrasound. And friend Kay had been waiting outside for me, but she came in to wait with me in the ultrasound waiting room. And I went back for the ultrasound. Now, this was the area that I was the most curious about because there weren't any videos really. There were a few, not too many videos about what to expect for an ultrasound. So it was a room, basically hospital room, not like a hospital patient room, but like an exam room. It had a gurney in it like they use in the ER, which had a blanket and a pillow on it. The lights were down low in the area, which was great for me because my eyes are a little bit light sensitive, especially since you're laying on your back, you're looking up. You don't want to get blinded, but also it helps the ultrasound tech read what she's doing. Anyway, so she helped me lay back or lay on my side and then roll over. They put a wedge behind my left side. So instead of laying flat on my back like this, I was actually laying a bit more like this. And I had to put my arm back up over my head like that and lay there. She opened up my jacket and she put a towel. She kept the jacket side covering my right breast, and she put a towel underneath my breast so that her hand was, on the towel. She went and got some gel, and it was nice and warm, which I was happy about. And then she proceeded to ultrasound. So they basically ultrasound the whole breast and specifically the nipple. And at one point she had to kind of hold my breast and hold the nipple up to get some good views. They went kind of under it. So like if this is the nipple, they went over it and they kind of went at an upward angle underneath it. They did down the side of my breast, because the sides, there's lymph nodes in the side. And then she got me all cleaned up and she said, okay, I'm going to do the right side also. And just for comparison, so she got the right side going and much quicker. She only took a couple of shots on the right side. But, as she's doing this, we're just, I'm just laying there quietly. We talk a little bit. She would, do a little bit of the ultrasound and then she'd reach over and she'd type some stuff in the computer and she would move the ultrasound and she'd type some more stuff. So I knew she was seeing things. So when she was done with the right side, she helped me get cleaned up and I got sat up and she told me I could get dressed. And I went back into the waiting room. And so I wasn't in there more than 3 or 4 minutes. And the radiologist came in and the ultrasound tech came in. Her name, by the way, is Jennifer. So Jennifer and the radiologist came in and they basically told me what they had seen. They had definitely seen a mass of some sort in one of my milk ducts on my left nipple. They said it's one of 3 things. It's either debris, which I'm assuming that's just skin cells and stuff like that, or it is a cancerous mass of some sort, or it's mass. They didn't say cancerous; they just said mass, or it's what's called an intraductal papilloma, and they really felt like it was an intraductal papilloma. And basically, a papilloma is a growth. A wart, it's basically like a wart, only it doesn't look like a wart, but it is like a wart. A wart is a papilloma, but not this papilloma is not a wart, if that makes sense. So it's basically this growth in the milk duct, which is causing the milk duct to be dilated, which is opened wide, and it's causing the discharge. So he said that if it's debris, they're just going to leave it alone. Well, he said that what I need to do, they want me to have a biopsy. That's the only way they can make sure what it is. So if it's debris, they do nothing. They leave it alone. If it's a mass, then at that point they do pathology on it, and then I get sent to a breast surgeon, and we go from there. And he said that since he's pretty sure it's an intraductal papilloma, that what they would do is, if it came back as that, then most likely, again, I would be sent on to a breast surgeon, at which point we would decide. He said sometimes they just leave them alone and they just let them sit there. Sometimes they remove them, and sometimes they remove the entire duct. From what I'm gathering, the chances are pretty good I'm going to have surgery next. But so those were really pretty much all the questions I had for the radiologist. At this point, I'm waiting on the biopsy. And so what I'm going to do is I'm going to end this video here. I've been yakking for a while, so I'm going to do some editing and hopefully make this a little bit smaller. I don't know if I will put it with the biopsy on the same video or if I'll do a separate one for the biopsy and then a third one for whatever happens after that, if there's surgery or whatever. I'm not sure. So we'll see. But for now, I've got this filmed. I'm hoping it makes sense. So yeah, I'm going to post this on my website. So if anybody has questions, about my experience, or if something I've said doesn't make sense, leave me a message and I will get back to you as soon as I can. So yeah, there we go. That is my experience with having a diagnostic mammogram and ultrasound. It was painless, relatively painless. Um, was the people there were professional and amazing, and I mean, if for anything else, I would enjoy visiting with the people and being there. They were amazing folks, and it was as pleasant an experience as one could have with a situation like that. So now I wait and be praying. I will be praying this whole time, and like another video I watched the other day, the lady offered to pray for anybody that had questions or that was going through this. And so if you're watching this video and you're getting ready to have a mammogram, or an ultrasound or biopsy, or you're facing something like this, let me know. I will pray for you, because I totally believe in the power of prayer. So anyway, okay. So thanks for watching. God bless. Bye.